Hello, and welcome to One World, One Health, where we chat with people working to solve some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. The Trump administration's sudden and ruthless slashing of U.S. involvement in global health has been shocking. Nearly as soon as he took office, Trump said he would withdraw the United States from the World Health Organization, hitting funding used to fight malaria, tuberculosis, HIV/AIDS, and a range of other diseases. And the new administration has also dismantled the U.S. Agency for International Development, firing nearly all its staff and saying its work will be done through the State Department. Despite promises, the U.S. has now stopped funding the United Nations World Food Program efforts to feed millions of people in 14 countries. The World Food Program says it's a death sentence for millions of people. Funding's been cut to Gavi, the Global Vaccine Alliance, and other groups. Until January, the U.S. was the single biggest funder of global health efforts. What does this sudden change mean for global health? To try to see what the way forward might be, we're chatting with Ramanan Laxminarayan, founder and president of the One Health Trust. Ramanan, thanks so much for joining us.
Well, thank you for having me back.
It's clear now that the U.S. Agency for International Development, USAID, is gutted for the foreseeable future. Other U.S. foreign funding is virtually gone too. And what else now? It's hard to keep tabs on everything that's gone.
Well, beyond USAID, we also have significant cuts at US CDC. The last estimate is that of CDC's roughly 12,000 employees, about 4,000 have been let go, which is a full third of the agency. The STD lab, the sexually transmitted disease lab, was shut down completely a few days ago. The chronic disease sections of CDC have all just been let go, which is a little hard to understand in a country with high rates of chronic disease and also some of the worst life expectancy per dollar spent anywhere on the planet. So for a country that doesn't do so well on health, shutting down large parts of the public health system don't really make sense. There are knock-on effects. CDC shutting down means that state health departments then don't have money. What a lot of people don't realize is that much of CDC's money doesn't sit in Atlanta. It goes out to health states. And in New Jersey, for instance, where I am today, the New Jersey Department of Health has layoffs because of CDC not having the money to send to them. That's all then also separate from what's happening with the National Institutes of Health, with the National Science Foundation. NIH particularly is really if you might think of the nursery where, drugs and vaccines and diagnostics and, future of medicine is born. And what happens there is what then comes out of the other end as products in about 20 years from now. And large parts of NIH are also under threat. So all round, it's a time which will go down in history as a time when U.S. health system and a research innovation system that was built over decades, if not centuries, has all been devastated in the space of just a few weeks.
And of course, this is devastating to the U.S., but it's also devastating to the rest of the world. Global health is going to have to look away from the U.S. for so much of this funding. Now, what's this mean for global health?
Well, in the short term, the disruptions are going to be significant in countries like Nigeria, for instance, which, derives a lot of its health budget from U.S. government funds. It's going to be a significant disruption. 20% of patients on antiretrovirals in South Africa depend on U.S. funding. It's going to be disruptive for them. India, for instance, or China are completely unaffected by what goes on in the U.S. with respect to development assistance because they're not recipients. I think in the short term, there will be a lot of difficulty which countries will have to come around to. But I think in the medium and long term, the biggest losers in this shutdown is really going to be the US itself, because number one, it won't have the engagement with science and technology and the soft power that it then enables in many of these countries, number one. Number two, the US does depend on the research in other countries to do things that would be simply too expensive to do here. For instance, CDC operates large facilities in Kenya and Thailand, which are sentinel sites for emerging pathogens in those places, which are cheaper to understand there than if we were to have them enter the United States. Not having that leverage is going to cost the US a lot in the medium to long term. So I think the damage to the rest of the world may be much less than we imagine in the medium term, where the world just figures out how to carry on without the United States. I think the United States is not irreplaceable. It's important in the short term because of the role it has filled in the past. But I think that its importance in a world going forward where, it doesn't want to engage is probably exaggerated.
So, where are countries and organizations going to turn to? How will they adjust?
Well, you start with WHO, for instance. Total funding at WHO from the US government will probably be about 20-25%, probably closer to 20%, including voluntary contributions. I think that's the kind of money that WHO, by improving its efficiency, which it will now be forced to do, can easily fill that gap. It's the US again, which will feel the lack of not having the engagement at WHO. In countries where drugs and vaccines are coming out from, say, Gavi or Global Fund or PEPFAR, I think now countries will have to be forced to step up. It will cause short term disruptions, but I think in about 3 or 4 years, they would have figured out that this is something that they absolutely need to do. And it's not something you can outsource to another country to really fill that gap. When I say the US, either it's the US or even philanthropy in a sense. These are legitimate roles for government. Now, these are all on the delivery side. On the innovation side is where there will be the biggest challenge because NIH does play a somewhat irreplaceable role in the world. NSF plays that kind of a role as well. And here I am really at a loss to see where that innovation engine will come from. The US has a unique combination of both the money as well as the ecosystem that welcomes the best and brightest of people around the world through an open immigration policy, which then allowed that magic of innovation to happen here in the United States, whether in technology or in biomedical sciences or literally anything else. You need those two. You need the money and you need the bright people who are not necessarily going to come from within your borders. By shutting down both at the same time, I think it does irreparable damage both to the United States, but also for innovation around the world. And that innovation will now move to places like China and India, where it's already starting to happen, where there are large populations who are young. They don't have the money just yet, but that will follow if that's where the innovation is starting to happen. I mean, you keep in mind, say, for space, for instance, India routinely puts into space rockets that cost a fraction of what it costs in the United States, or, is able to send a rover to Mars for less money than it costs to make the film The Martian. So I think a lot of this will now move to other countries. And again, the loss will be to the United States to not have the immigrants who do this work. And if you go to NIH, you'll see, many people that are European or they're from other parts of the world. And that's what makes these exciting places because it's like this sort of, grand central for ideas from around the world. And, I would say as an immigrant to the United States myself, that is really what this country made possible. And it's now no longer seen as an attractive destination to come and play that role.
But is there another country that can become a central destination like that? Because what's so special about NIH is that it's a mixing bowl that also includes a lot of money. We're talking $48 billion budget that's just been taken away. That is not going to be easy to replace.
Well, first of all, I don't think NIH's money is going to go away entirely. It may not be 48 billion, may get cut a little bit, but I think that both are required. You need the money and you need the talent. And it isn't going to go to any one other country. It may go to multiple other countries. And the US higher education system and research ecosystem is under serious threat. And here again, it isn't easy to sort of just replace this in some other country. It took probably, 200 years to build up the ecosystem that exists in this country right now. And it isn't as if this is going to easily get replaced in some other country. It will take time. But if you talk of a scale of, say, 30, 40, 50 years, what has happened in the last 2 months has seriously shaken the confidence of people that the US can be that safe haven for innovation, for biomedical research, for just creating things that it's been for such a long time. And confidence and trust, you can only break once. If you break it one time, then, people really have a difficult time sort of, imagining that it's a safe place to come and do that sort of work again. Money is secondary to talent. I think the damage to the immigration is understated. People don't pay attention to that as much, but that is probably more important than the damage to the funding and just waving a $5 million sort of gold card or whatever it is that, this administration wants to have to give people, place in this country. Rich people don't build stuff. It's really people who are hungry who want to, create something. They're at the other end. They can't afford, that kind of money, but they're willing to work very hard and create amazing things. And you take any amazing company in this country, they were all built in that sort of a way. And so I see the damage in both the money as well as the immigration.
So what you're saying is you're looking at the long term. Over the long term, the U.S. will be replaced. Are you thinking it's a more disseminated type of thing?
I think it already is affecting, the willingness of students to come here. Why would anyone want to subject themselves to, scrutiny at the border? I mean, now even US citizens entering the country are subject to secondary screening and all sorts of harassment at the border. Forget about immigrants. So I think we're going through a very, very dark time where honestly, if I were a student coming in, this would not be my choice of country to come in. And it takes time to undo that damage. If you go to the US Embassy website in New Delhi, which used to be a very friendly website, now the website is mostly a threatening website. It warns people about entering the US illegally, which is like the primary messaging on the social media feed. And I mean, you have to understand, it's not like the rest of the world is somehow trying to enter the United States illegally all the time. It is a great country, but, frankly, that's not what people are trying to do. And if that's the image that's projected, which is very unfriendly, then that stays with people for a very, very long time. I don't know if people who live in the US already appreciate the kind of damage that's being done just in the face of the US that is being shown on the outside.
In the short term, what do you see happening?
Well, your guess is as good as mine. I think we're being hit with a triple whammy, if you might. The first is destruction of the USAID infrastructure, which is the end of public health, which is actually delivering things to patients. So that's being dismantled, which causes a lot of damage. Second level is of destroying the research institutions and the public health institutions, CDC, NIH, NSF, which is the second tier of damage. The third tier is really the damage to the US economy itself from the tariffs, which also causes significant damage because why would you want to do business with the US if there's some crazy change in tariffs happening on a daily basis? The credibility of the US is at serious risk. And what's happening here is based on, and I think as many economists have said, a very poor understanding of how the global economy works. Nothing in the world is made in any country anymore. I mean, drugs, vaccines, diagnostics, they're all made in dozen, 20, 30 countries. So what does make in the US even mean? I think that this idea that we can deglobalize and then suddenly we can start making, I don't know, shoes here, or I don't know what it is that they plan to make here, but whatever that can be made here and then the rest of the world would want to buy it is frankly just lunacy. And as long as that myth stays that this is somehow some future of the United States, we're in for a very disruptive period of economic damage as well, which then in some sense eclipses the first two components I talked about. The $40-50 billion in USA funding is the amount that we're bleeding on the stock market every, microsecond. It's trillions of dollars wiped out. So, or, even compared to the NIH funding, for instance. So I think these three levels of damage work with each other. They're complementary to make things recovery that much more challenging. If we had only one or just two of the three, we could say, okay, we still have a strong economy. It's fine. Maybe not fine, but at least recoverable. But I think the scale of damage is at multiple levels.
One Health itself was just starting to come together as a vision. What's the hope for the idea of One Health going forward?
One Health, again, to back up folks who are listening to this who are probably wondering why One Health itself was relevant. One Health was relevant because we went through an era where we thought we could control infectious diseases entirely through public health, water, sanitation, and then following that with antibiotics and vaccines. And then we didn't really have to worry about infectious disease in a major way anymore because we had sort of control over the pathogens that were going to hit us. And then we could move on to other things. And then we fail to realize that we're changing the external world in multiple ways through our use of antibiotics, especially in animals. We're changing the world through climate change. We're changing the world through impacts on air and water quality, water through fertilizer use, air through just fossil fuel use, of course, deforestation. So in many ways, it wasn't sufficient just to have good public health, water, sanitation, hygiene, and antibiotics. We then were facing a re-emergence of a lot of these health threats because we had failed to account for the other sorts of damage we were doing to the external world. So it's really this idea that infectious disease are all coming back in a major way. That is really the idea behind One Health, in a sense. And that is not going to change. The next pandemic is not waiting for NIH to have money. It's not waiting for CDC to be, ramped up. We already have H5N1, which is a serious threat. We have things like measles, which should just not be a threat in the United States coming back. I don't think people even realize how deadly a disease measles is, how rapidly it transmits, the damage that it does, the immune amnesia that it results in. I think already folks in the US government are backing off from the anti-vaccine sort of a stance. But I think, if anything, the impetus for One Health is going to be even stronger because One Health was about the stuff that we needed to fix in spite of having good vaccines and everything else. And now you're suddenly saying, wait a minute, I have all these new threats, but then all the other stuff that I already had going for me, like not having to worry about measles, is no longer reliable. I have to worry about that as well. It just means that we have a much bigger problem on our hands. Gavi's funding being threatened is a serious threat to the world, to the children around the world, but also to the United States. So I think, if anything, it will then come back to bite us as a much bigger crisis. And then maybe that will then promote a reinvestment in health in a big way. Again, the US has some of the worst health metrics for a wealthy country, despite spending a huge amount of money on health. The idea that this country of all countries can afford to cut back on public health or research is simply laughable. If anything, it should be spending far more on public health and research, not less. And maybe people have just forgotten that this is where their medicines come from. When they have cancer, that's the drug or the CAR T cell therapy or whatever they are on started in NIH. They don't see that connection right now. But I think that realization will come back. And I have no doubt that the US will reinvest in health in a big way. It simply has no choice.
Ramanan, thank you so much for joining us.
Well, thank you for having me.
Listeners, if you enjoyed this podcast, please share it. You can find links to this and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Laxminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.